I'm Dr. Lauren Bramley. I practice in Hong Kong at Dr. Lauren Bramley and Partners. And I've also recently joined a practice called Project Skin MD in Vancouver, Canada, which is my hometown. I attended University of British Columbia in Vancouver, Canada, and then I did a family practice residency at University of Washington in Seattle. So family practice is how I started. I've always been into fitness, I've always been into sports medicine, but I've always loved nutrition. And before getting into anti-aging, I co-authored a cookbook about how to feed babies in their first year of life. And that's what got me into omega-3 fish oils and nutrition and how essential nutrition is for health and well-being in the brain. And from there it just took off. I'm board certified with A4M. I have done that over the past 5 years, and now I'm a fellow. And the nice thing about A4M is if you want to talk about continued medical education, nothing beats it. Every year it's different, it's very progressive. I've also done a master's in endocrinology. I did that through the Chinese University of Hong Kong, and I like having the endocrinology background, and I understand that approach, but I also like to integrate it with the anti-aging. I think bioidentical hormones are critical to health. That's really what we are as we age, is just a decline in hormones. And people will get symptoms, but they also get a lot of things that they can't see, such as osteoporosis, heart disease, the onset of dementia or memory loss. And these things can be really corrected with bioidentical hormones. And it is about balance. It's about making sure that all of them interplay in the right way. You can really get great results by layering on lifestyle with the bioidentical hormones and nutrition, supplements. So together, it's a harmony of those factors. And what I tell people is, once you achieve the balance with the hormones and the supplements, you ask yourself, could I really get a disease the way I feel? And if you're like most of my patients, they'll say no. I feel like I could have gotten a disease 5 years ago when I was exhausted, I couldn't sleep, I find it difficult to wake up in the morning, I didn't feel good, I had body aches and pains, brain fog. And then once this is corrected, you ask yourself, could anything really happen to me? And it's true. We have less disease. Once the hormones are balanced, less disease, and you can see it. I see it in my practice. I've been practicing for 10 years. My practice has gotten bigger and bigger and bigger, and I have less and less and less of the nasty things like cancer and heart disease. I have a master's degree in endocrinology and diabetes and metabolism, so I help people figure out what their issues are. It's namely insulin resistance, and once there's an understanding of insulin and how it works in the body and what it's doing to you and how you can commit to lowering your insulin levels. It's about lifestyle, it's about nutrition, it's also about supplements that are really, really effective in lowering insulin resistance, and also medications. Patients need help, and what I try to emphasize is that insulin resistance is correctable. It's a way of preventing diabetes. So the idea is to really, really be aggressive with the treatment, and the patient will be happy because they'll get results. And I'm happy as their doctor because they won't get diabetes. And diabetes is going to hit 1 in 3 of us. It's a major epidemic, increasing like crazy in adults, children, teenagers, you name it. We're all prone to diabetes thanks to insulin. So I really work on helping my patients understand that, what their number is on the page, and keeping it in a good, healthy range. I really enjoy cosmetic medicine. I think of it as art class. It's kind of the fun part of the day. Mind you, I really like the foundation of anti-aging medicine, but the two can go really well together. So I will see people for a cosmetic procedure, and while I'm doing that, I'll hear about how they're feeling, or I'll observe things while I'm doing it, and I'll suggest to them, you know, why don't we look at your nutrition, or why don't we look at your hormone levels and see if we can get results that you're trying to achieve with cosmetic medicine, if we can help using anti-aging medicine. So to me, I could never abandon anti-aging medicine and just do cosmetic all the time, because the two really interplay. And a position that I'm taking in Vancouver is actually at a skin clinic. It's an excellent clinic called Project Skin MD, and they have, you name it, for cosmetic procedures. And what I bring to the practice is the anti-aging aspect, and the two go so nicely together. So if you'd like to know more about my practice and anti-aging medicine, please go to laurenbramley.com or projectskinmd.com.